What are your criteria for grant making?
Yeah, so there's like four very broad things that we're looking at, and then each of these will like break down into almost like infinite levels of inquiry. But the big questions are first, what's the evidence that this works? So like, how do we know that this program is having the impact you expect on the world? And so let me give an example. We provide a lot of support to malaria nets. These are nets that people hang over their beds at night. They protect against the mosquitoes that transmit malaria. There are more than 20 randomized controlled trials. That's the sort of gold standard for assessing the impact of a medical program that show that when you give out these nets, they reduce cases of malaria. There's also a number of studies that measure mortality directly. They reduce deaths from malaria. And so question number one is just like, what's the evidence that this program works? Question number two is like, how cost effective is it? What bang do you get for your buck? So, okay, I can tell you that malaria nets are effective, but now you want to know, well, how much does it cost to buy one? And how much does it cost to distribute them and get them to the people, all the way from the factory to the village? Uh, you want to know if you purchase 100, how many actually reach the village? Some of them might get lost or stolen, and some do get lost and stolen. How often do people hang it up? How often do people not even bother to hang their nets up or use it for something else? Um, Over time, mosquitoes get resistant to the insecticide in the nets. So you want to know, like, how do I take that? So all of that, go take that into account, and you say, all right, well, what am I getting with the money that I'm spending? That's cost effectiveness. And what we're aiming to do is then direct funds to the programs that are most cost effective, get the biggest bang for your buck. And let me just pause here because I don't know, it's like easy to sort of like talk about rigor and throw a lot of numbers out there. And I think something that's just like worth keeping in mind is that we use these numbers in some ways. Doing all this work helps discipline our thinking because we can compare things to each other. But when we talk about, oh, it costs this much to avert a death from malaria, I mean, there's a huge uncertainty band around that number because there's so many factors. And then two other factors that we look at that are those are kind of the core. And then two others are what we call room for more funding, which is really asking the question, what would marginal funding do in this cause? Like you might say, historically, uh, you've given all this money to a program and it's had all this effect. But what you really want to know is right now, given all the money it's get, if you're a donor who's giving additional dollars, what's the marginal effect that'll happen? And I don't know, this is true everywhere. Like as organizations, as companies reach larger scale, their ability to have impact, shifts based on, their place in the ecosystem. And so we're looking at this room for more funding question. And then finally, transparency, which is both the fact that I mentioned this at the beginning that information wasn't available. Well, it's still the case that most information about organizations' impact is not readily available. And so we need organizations that are collecting data and willing to share data with us. And if they're not going to share, if they're not going to be transparent, there's really nothing we can do because the information doesn't exist. I will say, having gone from raising like $30,000 a year to moving, a multiple of that, organizations have an incentive to share more information with us now. So that's become clear over time. And then also transparency is important because we're never going to see everything. And so, we're looking for organizations that are going to proactively share with us the information that's most important, meaning tell us when something goes wrong, tell us that they're struggling with something, rather than like try to hide it and have us find it after the fact. And there are a bunch of organizations that, we work with that I think do that well. And so, yeah, those are like the four big buckets of things that we're looking at when we assess organizations.
Yeah, it's all obviously great criteria. The one that jumped out at me when I was reading through this initially was the room for more funding things. It reminds me of stock prices. Like if you find a really good stock and then everyone buys it, eventually it's not a good stock anymore. It sounds like it's a similar kind of principle where if you find a really good efficient way to give, if you give all of your money there, all of a sudden it's actually not so productive anymore.
Yeah, so I think it's a great, I want to like say why it's a great analogy. And then I think there's like an important way in which the analogy, it's like really different in charitable
Hmm.
giving from the stock market. So I think it's a great analogy because, um, yeah, you don't get to buy the average return. You only get to buy like what's happening in the future. And if the price got bid up, or in the case that I'm talking about, if malaria nets were totally funded already, like you don't want to give more to there. I mean, it is not the case. The malaria nets are totally funded. Like they need more money. But so in that way, the analogy holds. And then I think there's this important way where the analogy breaks down, which is in the private markets, the person who's paying is the same as the person who's benefiting. So like for example, it's like if you buy an iPhone, you like know the iPhone is good because you get to use the iPhone. And if the iPhone was terrible, Apple would not have succeeded because people wouldn't have kept buying it. And this like totally breaks down in the charitable market, so
Hmm.
to speak, because the person who is benefiting from the program is the like person living in the Democratic Republic of Congo, and the person deciding to pay for the program is the donor, sitting somewhere else around the world. And that creates a real problem because basically the fact that the price got bid up doesn't necessarily mean that it's a good deal, or the fact that so much money has come in doesn't necessarily mean that it was successful. And so what I think, anyhow, that implies a lot of things, but one of the important things it implies is that there can be places where a lot of money is flowing in, there's more room to keep giving more, and you're still getting like sort of I don't know how to put it exactly, but like a ridiculous price for your money because the charitable market doesn't have the same mechanism to be efficient that the investment
Hmm.
market does.
How do you identify top charities?
Yeah, so there's basically like three ways that we go looking for organizations. One is we're looking at academic papers that are reporting on the effectiveness of programs. So, first criterion, evidence of effectiveness. Most of the information about what is effective is coming from the I don't know what to call it, like the community of academics who are studying things like, well, how do we increase growth in low-income countries? How do we improve health? Does this particular program work? So we're just staying up to date on that. When there's a program that's effective, we are looking to see if an organization is implementing it. Second, we are talking to major, like very large international non-governmental organizations, often referred to as INGOs. We're asking them the question like, what are your programs, and do you know if they're working? So go right to the implementing organizations themselves to say, what are you doing and do you know if it works? And then finally, we have on our research team, and one of the reasons we're fairly large is teams that focus on different cause areas. So malaria, water, vaccines, et cetera. And they are very embedded in the community of people working on those programs. And so they're telling us about what's happening and what's working. And when we hear about new things that we should look at, we're able to bring them in and put them through our process.
Hmm.
Hmm. Wow. So reviewing research, but also kind of being on the ground where stuff is happening to identify opportunities.
Yep.
What are the current top charities?
We have four organizations. So two work on preventing malaria. Malaria is still kills about 600,000 people a year, most of them
Wow.
young children. Think about that in like daily terms, it's like a crazy number. So there's two organizations. One is the Against Malaria Foundation. They purchase and then facilitate the distribution of malaria nets that reduce that protect against malaria all around the world. They've been a top charity for a long time. The other one is an organization called Malaria Consortium. They run a program called Seasonal Malaria Chemoprevention. You can sort of see these are maybe organizations not the best at marketing and fundraising, but the actual programs they run are amazing. And this is a newer program. Like the studies for this seasonal malaria chemoprevention, is preventative malaria medicine, were only conducted, I think they finished getting in 2011, 2012, these studies were finished. Then they started getting rolled out globally. And basically, it's delivering uh, a set of preventative malaria medication to children under 5 during the first week of each month during the time of year when malaria is most prevalent, like mostly in the area of Africa called the Sahel. So that's another very cost-effective program. These programs, just to give you a ballpark figure, cost, about $5 per person reach, like order of magnitude. That it could be a few dollars less, a few dollars more, but per year. And then they we estimate all in, again, like very roughly, we're talking about like about $5,000 to avert the death of a young child from those programs.
Hmm.
So those are two. The other two, one is Helen Keller International's vitamin A supplementation program. They're serving areas where vitamin A deficiency is extremely high. There's a series of randomized trials from about, let's see, maybe like 30 to 40 years ago at this point, that show big reductions in child mortality from uh, delivering vitamin A supplementation in high vitamin A deficiency contexts. And so that's a very simple, straightforward program that we support. And then finally, an organization called New Incentives. And they provide conditional cash transfers that are incentives for immunization. So basically, there are families who live in northern Nigeria. At the time that we started supporting New Incentives, about 60% of children were receiving their full vaccine series in that location. I think there could be a lot of reasons why they weren't receiving their vaccines. It could be some vaccine hesitation. It costs money and is pretty challenging often in rural areas to get from home to the clinic to receive the vaccine. And so these relatively small cash incentives encourage them to come in a randomized trial that we actually supported to measure the effect, that immunization rate went from 60% to 80%, roughly
Wow.
among children. And so that program is now like scaled up across other states in Nigeria.
Hmm.
And that rounds out our four top charities. So it's a very short list. We're not trying to say like these are the only good organizations out there. There's actually a lot of other organizations we give to through the direct grant making that GiveWell is able to do. But these are the four that I'd say have the combination of the strongest evidence behind them. We've worked with them for a long time. They have a strong track record, and frankly, just like additional money to them at the margin is funds that we think will are competitive for doing some of the most impact that you could with charitable dollars.
Hmm.
Why do top charities focus on global poverty?
Yeah, it's actually not how we started out, but we came to it through our research. So when we started out, we were looking both at social programs. At the time, in the United States, we were living in New York, so looking at social programs in New York City. And after a couple of years of research, what we found was just how big the differences are in terms of what, money can accomplish at home, for us at home versus overseas. So, you know, we we think we're talking about single digit thousands of dollars to avert the death of a young child from giving overseas. Some of the programs we looked at in New York, it might be a charter school program. So, bringing kids from low income families in New York into an improved school to improve educational outcomes, that was in the range of $1,000 to $2,000 per year in school. And so just like the difference in the magnitude of the effect, a few $1,000s per life saved, a few $1,000s per year in school really caused us to focus our energy overseas, where we think just in aggregate, the money we direct will do more good.
How frequently do the top charities change?
They've been pretty static recently. I mean, we've recommended the Against Malaria Foundation for a really long time, and there just isn't that much, news that comes out that would cause them to fall off that we're looking at it. Um, but they've shifted a lot, like over history. So we've had times where the top charities list was like 8 or 9 organizations. We've had organizations that we put on and came off for various reasons. It could be because there were updates to evidence. It could be because we just frankly thought we could get do a higher impact, like giving elsewhere, and they weren't competitive anymore with the best things that we could find. But maybe I'll just tell like one example is we supported one of the things that we've done in our history is try to support the creation of new top charities. So we've said when we started out, our attitude was let's just see what exists and try to direct funding to the very best things we can find. And after, let's see, like 6 or 7 years of doing that, we're like, all right, we've seen a lot. What can we do now to try to create more organizations that we could add to this list? So one of the groups I mentioned, New Incentives, which does immunizations, they're a group that we really help support, and we support it through the way. They have a sort of a long winding story of getting data and having to pivot and learning that what they were doing wasn't working and moving on to other things. There was actually an organization. When did we do this? This was about 10 years ago. We supported an organization to test an idea for what they called seasonal migration. And the idea is that in Bangladesh, many people are small scale farmers. And during the farming season, they have plenty of food. But in the lean season, when there's no harvesting and crops, they don't have money and people are really struggling. They don't have enough food to eat. And some folks migrate from rural areas to urban areas. And there were a series of randomized trials coming out of economics departments and universities that showed if you gave people a small cash incentive, they would migrate, and then they would earn more money, send it back to their families, and I think most interestingly, would then migrate without the incentive in subsequent years. And the basic idea behind it was then people were feeling some risk aversion about migration, but if you could show them with this cash incentive, reduce that risk aversion, then they see that it was good. Okay, so we decided this looked great. This was a very promising program. And we supported an organization called Evidence Action to roll this out as a new charitable program. It was actually on our top charities list, I think, for a year. But at the same time, we said, consistent with our earlier discussion about scale, the research studies, I think, I may be getting these numbers wrong, but they were reaching about 1,000 people, 2,000 people at a time. At scale is 100,000 people. And all of a sudden you need to come up with like a
Wow.
new way of operating. And so we supported a randomized trial of that program, and the trial found no net increase in migration between the treatment group and the control group. We kind of tracked those results over 2 years, and they're like, all right, I don't know, this is just not working. And so
Hmm.
they shut down the program and they came off the list, and we moved on. And I don't know, I just think it's a good example of how we try to operate, and also like why it's important to operate the way we do. Like there's this alternative universe where we're just like seasonal migration, go. Like this obviously works. There's randomized trials. I mean, that's even better than like what most things would have behind them. But it was that extra effort to keep measuring and I don't know, like seeing that we could be wrong and we were wrong, that I think over time is leading our recommendations to be higher quality.
Such an awesomely nerdy way to approach this stuff. I love it.
Awesomely nerdy
Awesome and
described it pretty
nerdy.
well. Or at least nerdy, hopefully awesomely nerdy.
You mentioned the cost to save a life. You mentioned a couple numbers, like a few $1,000s, maybe $5,000. Why is the cost to save a life so high when something like mosquito nets or malaria drugs are, I mean, pretty inexpensive?
Yeah, I mean, there's a few reasons. The biggest one is that even though malaria kills so many people every year and is so prevalent, the chance that any individual child will die of malaria is relatively low. I don't want to quote this number wrong, but it would be in the range of like 0.5% to 1% per year is like the risk of death, I think. And so with that in mind, you have to distribute a lot of nets in order to prevent one child from dying. And then you have all the other problems that I mentioned along the way with that. That's assuming like perfect, like nets being perfect at preventing malaria, but they're not. Nets only
Mhm.
prevent about 50% of the cases because mosquitoes bite at night. Well, some of that is when you're sleeping, some of that is when you're outside. Some nets get stolen, a bunch of nets don't get used. Insecticide resistance builds up. Nets have holes over time. You got to redistribute them. And so we have to take all of that into account when we're trying to come to that bottom line figure. And I actually think this is a mistake that we see sometimes when people are trying to do like more simple calculations. If you assume everything goes right, your numbers are going to look really compelling. But in reality, things, I mean, in every program, a lot of things go wrong because uh, you're trying to like deliver something to some of the hardest to work places in the world. It's places where like literally like people are dying for the lack of a $5 malaria net. I mean, that's a place that's quite challenging to be in.
Hmm.
And so a lot goes wrong. And so when you add all those things up, the cost to save a life is much more expensive than that like cost to purchase that commodity. And then at the same time, it's sort of crazy to think about the fact that, you could save someone's life for like single digit
Right.
thousands of dollars. That's like kind of a
Yeah.
wild reality.
Hmm.
So, how do you evaluate whether your top charities are actually giving the results, producing the results that were expected based on like some of this past academic research you talked about?
Yeah, I mean, this is really hard. So, I'm trying to think like where I should start with this. I guess like the way in which what we're doing is we're constantly looking back at what we expected to happen, what organizations are able to share with us about their program delivery, what problems they ran into. So we can say, well, you thought it was going to cost you $5 to deliver a net, and that 80% of the nets were going to be used. And then in reality, it cost $4 and maybe 70% of the nets were used. So we can get all that data and reassess the results relative to expectations. That's like one input. Another thing that we do is, try to go back and obsess about like our research and where we might be wrong. Like, what are we missing? What could we get wrong? Get outsiders to do that. Um, and then at the end of the day, there's just a lot that's unknowable. So, we rely on a bunch of randomized trials from a long time ago, and the world is different today than it was a long time ago. We've tried to collect some of that data and rerun kind of like reanalyze the data ourselves. So we have these like published academic papers from the 90s and the early 2000s, and we've just like failed to be able to get our hands on that data. We've thought about ways that we could pay for like new randomized controlled trials of the same programs. And there's a variety of challenges I'm happy to go into that make that difficult. And so at the end of the day, there's like also a lot that is unknowable. Maybe most importantly, like we have estimates of the number of deaths averted because new incentives has caused more kids to get vaccines than they otherwise would have. But that relies on a lot of guessing and thinking and making our best analysis of how many additional kids are going to get served. That's not a quantity that we can then follow up on and measure empirically, and what those vaccines did for mortality rates from the diseases they're protected against. Like we just don't know. So we do our best and also just like recognize that there's a lot that is unknown at the end of the day about
Hmm.
what's ultimately happening.
Yeah, it's like you said earlier, you guys, you're not an academic organization. You have to find the places to give. Like the money has to move. So it's like you got to, that's, and in some cases you have to make a best effort. How do you measure the cost effectiveness of the charities when you're evaluating them?
Yeah, so mostly we're just trying to, turn more or less like everything into either an impact on health, which could either be like averting a death or giving people like more additional years of healthy life. And in sort of the high-income countries, we talk about QALYs, quality adjusted life years, and in low-income countries, people talk about DALYs, disability adjusted life years, which are just the inverse. But just trying to look at those two quantities. And then a lot of programs also have effects on people's ability to earn money. And then we say, yeah, like how much did you increase income? And put all that together into some, overall measure of like GiveWell's version of the good. And really the question we're asking is how much does a donor have to put in to get out like that amount of good, that reduction in deaths, that improvement in health, that increase in income. Lots of guesses that go in there. Lots of things in there are debatable, like philosophically. But we're doing all of that in these like giant spreadsheets that if you want, you can, kind of look at on our website, and we try to make all the reasoning behind them available. But we're trying to do that, very meticulously to try to get the best answers we can.
And what effect does uncertainty have on your cost effectiveness evaluations?
Yeah, so we don't we don't do something where we're like very how should I put this? Where we're like formally modeling the uncertainty and then have like a formal way in which the uncertainty influences what we do. But the fact that we know that we have a huge uncertainty about these numbers has a big effect on how we operate as an organization. So, if you go to a bunch of our pages, like our top charities page, there'll be this simplified cost effectiveness model where we try to show our best estimate, but then also, well, I don't know what we call it, either like low and high or like 25th percentile and 75th percentile outcomes. You can see there's like a wide variation in there. And so the biggest thing that does in our work, it does like two big things. The first is we it's a reason we care a lot about that follow-up information, because we really want to know like what world are we in. Half the time we'll be outside the 25th or the 75th percentile in our outcomes. And so we really need to keep getting more information to learn, because we know that ex ante we just like don't really have the answer, and so it's imperative that we keep learning. And then the second thing is, at some level, we just don't let our decisions be made like only by the numbers. So and so what I mean by that is like to give sort of a simplified example, like let's say that our threshold for cost effectiveness with $5,000 per death averted, and then one organization is 5,100, and one organization is $4,900 per death averted. I think we don't view those as like meaningfully distinct. At that point, we're like, okay, those are close enough quantitatively that qualitative factors have to be the driving factor in the decision. And that's part of the reason that the transparency is so critical. So we can describe like what those qualitative factors are, and people can look at them themselves. And then the final thing I'd say is that like we are more prone sometimes to want to take some, be open to doing things where we're not sure. I don't know how to put this exactly, but like if the bet we're making is right
Mm.
up front, but there's some chance that it could be really good. And so we'll take the bet. We know that, we don't know how it will turn out, and then we'll see down the line if it worked out or not. And then we can either, go forward and scale up if it goes positively, or like move on if it didn't.